Did you know that good gut health begets good brain health? Specifically, if you're taking care of your gut, you're less likely to have mood swings and mood disorders. Research has shown that if you have a mild mood disorder, a good diet might be all you need to correct it with the help of your mental health professionals. I'm Dr. Ngozi Okoro, and we've talked about how the gut and the brain are connected. Today, we're going to go a little bit more in depth. You have a whole separate nervous system in your gut. It's called the enteric nervous system. The brain and the spinal cord are called the central nervous system. They're connected via the vagus nerve. Vagus nerve is cranial nerve 10, and it goes from the back of the brain and it goes down your thorax and innervates, which means supplies a lot of your gut. So that's how your central nervous system and your enteric nervous system are connected. They are also connected via hormones and neurotransmitters. Examples of these neurotransmitters include serotonin, which is the feel-good neurotransmitter, GABA, and dopamine. Now, a huge percent of serotonin is actually produced in your gut by your microbiome, which is those trillions of bacteria and viruses and fungi and parasites. Some studies actually say up to 90%. What does this mean? This means that when your gut is healthy, it optimizes production of serotonin, and your mood, your cognition, and your memory is optimized because your gut sends messages to your brain and says, chill out, everything's going on down here. On the opposite end of the spectrum, when production of serotonin is low, you are more prone to mood disorders. Now, we know that people who are depressed have a very different microbiome from people who are not depressed. How do we know this? Remember the American Gut Health Project that was published in 2018 with over 10,000 participants, over 40 countries? Researchers discovered the link between the composition of the microbiome and people with depression. Now, although taken from two different sides of the Atlantic, samples of the gut microbiome proved to be consistent between the US and UK populations. This shows that the microbiome and disease strongly influence each other, independent of the environment that the patient lives in. Research has also shown that fecal transplants, what's a fecal transplant? That's when you take feces from one person and put it in another person. Now, we don't do this for obvious health reasons, infection reasons, and all that. But under standard conditions in experiments, they transplanted feces from people who were non-depressed to people who were depressed to treat depression. Now, how does this occur? People with a mood disorder have an imbalance of bad bacteria, which produce inflammatory substances that get distributed to the brain and the rest of the body. Do you see a pattern here? Bad bacteria leads to mood disorders. How does it do that? Because the bad bacteria produce systemic inflammatory substances. These substances go to your brain and affect the mood. Now, remember that an overgrowth of bad bacteria compared to good bacteria is known as intestinal dysbiosis. Let's summarize this gut-brain connection leading to mood disorders. Gut dysbiosis, which is an imbalance in the gut's composition, can disrupt the gut-brain axis. Dysbiosis affects that lining of your gut. Remember the cells that are joined together through what we call tight junctions? It affects the lining. Well, let's call them bacterial products, are able to go through the lining through that mechanism called leaky gut. They lead to low-grade inflammation, which can also affect the brain, leading to mood disorders, impacting brain function, impacting brain behavior. We call this neuroinflammation. That is the backdrop for how intestinal dysbiosis, which is an overgrowth of bad bacteria, can lead to mood disorders. Well, so how do we achieve a healthy gut, Dr. Okoro? We don't want mood disorders. We don't want mood swings. We want to be stable. How to achieve a healthy gut? You all know this. Remember water? Think of your gut as plumbing. It helps to keep everything moving. Did you know that your stool is 75% water? We're going to talk about it in my next video. However, how to achieve a healthy gut? Water. Remember how much? 90 ounces a day at least. Fiber. Remember prebiotic fibers, which is the stringy fiber you find in asparagus, in garlic, in bananas, in things we call Jerusalem artichokes and chicory roots. Those are not as commonly found, but there is a lot of ways to get good quality prebiotic fibers. Now, also remember those prebiotic fibers feed your good gut bacteria, produce postbiotics, produce short-chain fatty acids, produce butyrate. This is how to achieve a healthy gut. Number 3, remember exercise. Think movement that stimulates your peristalsis, which is the gut's way of moving things along. Think movement. Now, do you know where we find the worst GI, gastrointestinal issues? It's in people with nursing homes. And it's not because they're older, it's because they don't move a lot. Now compare this to people who run long distance. They're just moving all the time and their gut motility, ka-ching. Other ways to achieve a healthy gut: sleeping 7 to 8 hours a night, having regular meal times, having regular wake up and sleep times. So this is the difference between you're going to war, okay? And who are you going to hire? Are you going to hire the 25-year-old with all the muscles? Or are you going to hire the 90-year-old grandpa who's reading bedtime stories to his grandchildren? Apologies to all the wonderful 90-year-old grandfathers. But that is how to get the microbiome that works optimally for you. Let's say it again. Water, fiber, exercise, excellent sleep, regular meal times, regular wake up and sleep times. Now, what's the opposite of a healthy gut? What's the opposite? You know this. Diets high in ultra processed foods, diets low in fiber, diets high in unhealthy fats, diets high in sugar and salt. All right, Dr. Okoro, how long is it going to take me to see all these benefits? I've been eating all this broccoli. No, wait a minute. Did you know that within 4 to 14 days, you can start to see changes in your gut microbiome with a healthy diet? Did you know that? Mental clarity changes take 2 to 3 weeks, and longer term changes take between 2 to 3 months. Did you know that the medications that a lot of psychiatrists use to treat mood disorders like SSRIs, that's how long it takes for them to kick in? So I'm not saying stop medicating and you must treat any mood disorder with your mental health professional. What I am saying is that this can be an excellent addition to your therapy. This can make your therapy smoother. This may decrease the need for medications. This may even lower the dosing of medications that you need. I will leave you with these statistics. A healthy diet like the Mediterranean diet is actually associated with a 30% reduction in the risk of developing depression. Did you know that? Did you know that recent reviews of randomized controlled trials suggest that a Mediterranean-style diet can significantly reduce symptoms in people who are already diagnosed with mild to severe depression who are on therapy? Mediterranean diet is that diet in whole grains, in fruits, in vegetables, and healthy fats. Just what I'm trying to convince you to eat. So, dear friends, if you would like to have a stable mood, if you would like to have better control of your mood disorders, you want to eat a healthy, balanced diet. High in fruits, high in vegetables, high in whole grains, high in lean proteins, high in, well, some healthy fats, and lots of water. Thank you so much for listening. My next video, we're going to be talking about the part 2, what your stool is telling you. This is very important, so please jump in and we'll go through it together. Be well.